That rat with multiple breasts that ran across your compound, threatening to enter into your kitchen. You must prevent it though, it's a dangerous one. Welcome to Dr. Dammiee Medic TV. Have you subscribed? Not yet? Why are you waiting? What are you waiting for? So let's talk Lassa fever. Lassa fever is a viral hemorrhagic fever. What does that mean? That means it causes fever and after some weeks eventually leads to bleeding from different parts of the body, from different orifices, the ears, the nose. Even pregnant women can present with bleeding, whether as an abortion or far gone in the pregnancy, they can bleed. And that was why a doctor contracted this disease from a pregnant woman whilst conducting cesarean section in them. 8 out of 10 people who contract this disease only develop mild symptoms, whilst 1 out of 5 become seriously ill. Okay, so let's break it down. How does this fever spread? We need to know. From rats to human. Eating contaminated food with rat urine or droppings, drying garri or grains in the open, leaving food uncovered overnight, and sweeping rat droppings and inhaling dust. From human to human too, humans can also contract this disease from other humans. Contact with blood, urine, vomit, stool, or saliva, or safe care of sick relatives at home, and poor infection prevention practices in hospitals. And this is the reason why healthcare workers are at risk of Lassa fever. Lassa fever, I must say at this point, is not spread through hair like COVID. It spreads through direct contact. So how do we prevent this illness at home and the community? Control rats. Don't live with them. That's why if they want to enter your home, you must put forces against them not to enter your home. Block holes in walls and ceilings. Use rat traps safely though. Keep surroundings clean. They're attracted to dirt, so why keep garbage around you? Dispose refuse far from your home. So with no rats equals no Lassa. Protect your food. Store food in covered containers. That your garri, rice, beans, just lying on the shelf. It's dangerous, so it's dangerous to your health. It must be in airtight containers to keep them safe, so that the rat will not urinate in them, or the droppings, the feces of the rat will not get into them. Re-eat leftover food before eating. Avoid drying food on the roadside or open ground. Wash fruits properly. Wash fruits properly. You can even wash your fruits in white vinegar. Yes, 1 part of white vinegar in 4 parts of water. You can use to also wash your fruits. If a rat has touched it, don't manage it. Discard it. Saying that, let me just remove the part where the rat has touched. It's not going to work here. Clean safely. Don't sweep dry rat droppings. First wet the area with water or disinfectant, then clean using gloves or plastic bags. Breathing in contaminated dust is a major risk factor. At home care, what do you do? If someone has fever that is not responding to malaria treatment, you used your anti-malaria for 3 days and is still not responding, with sore throat, chest pain, vomiting, bleeding, or weakness, do not treat at home. Refer early. Early treatment saves lives. So prevention for health workers, because my talk is also to health workers, because health workers are at risk of contracting this disease. Any fever that is persistent, does not respond to anti-malaria, comes with sore throat, bleeding, or facial swelling, think Lassa until proven otherwise. I tell my doctors, high index of suspicion, history of travels, previous fever, untreated or responding. These things we must ask. Even in pregnant women who come in bleeding, we must ask for risk factors and things that can point to Lassa fever in them. Standard precautions are non-negotiable. universal precaution practices: hand washing before and after every patient, gloves for all body fluid contact, masks, gowns, and eye protection when indicated. Lassa does not forgive shortcuts. Okay? It doesn't know niceness. Oh, I'm trying to be nice. Let me touch the patient before. No, Lassa does not know that. Isolate early. Suspected cases should be isolated immediately. Minimize unnecessary contact. Inform infection control teams promptly. Delay equals exposure. They must have infection control committee or team in every facility. Okay, protect yourself. A sick health worker means a broken health system, and you know we are not many. Please, we are not many already, so we can't afford a sick health worker again in Nigeria as it is right now. No, more patients are at risk if there's a sick health worker. Protecting yourself is professional responsibility, not fear. Key warning signs to never ignore: red flags: fever not responding to treatment, bleeding from nose, mouth or gums, vomiting blood, severe weakness, hearing loss after fever. That is very important, and when in doubt, refer, test, and isolate. So what's the call to action? Lassa fever is preventable, it is detectable, it is treatable if caught early. From the kitchen to the clinic, from the market to the hospital ward, prevention is everybody's job, not just left to healthcare workers. Kill the rats, cover the food, protect the caregiver, protect the health worker. Because when we prevent Lassa fever, we save families, colleagues, and communities. If we do not do this, we put everyone at risk. We are all at risk. So this is for everyone. God bless you. Dr. Dammiee here.